Okay, when you're looking at the periphery of the body, and when you look at, I'm going to start off with the venous side right over here. You're going to have a subclavian vein, and before that it's a brachial, but we're going to focus at this point. Subclavian vein is going to come in bilaterally, and as it goes from the extremity, as it goes toward the midline, first thing that's going to happen is that the smaller external jugular vein is going to drop its blood content into the subclavian. So you're going to have a small vessel, which in most cases you can't see. And then as it works its way down this way, there's a larger pipe, as we can guess, coming down and bringing its contents in, which is going to be internal jugular vein. Where the two meet, you get somewhat of a bulbous appearance, and that's the birth or beginning of the right, we'll make it the right brachiocephalic vein. So at that point, until it goes down to SVC, it becomes the brachiocephalic vein. Left side, same thing's going to happen. So I'm going to start off with the brachiocephalic vein on the left side. Here we go. And what's going to happen is that this baby here is going to come across the midline. So what happens is the left one's going to cross what we call the anterior mediastinum. The one from the right is already formed, and it's going to begin its journey down this way and down this way, and eventually right around maybe the area of T4, give or take, they're going to come together just to the right of the patient's midline and form the SVC, superior vena cava. So what you have is a series of transitions that you need to pick up on. For our learning purposes, we'll actually see the internal jugular vein. We'll see where the subclavian vein comes into play. Where they come together forms brachiocephalic vein bilaterally. The difference would be the right one's going to stay near the midline. The left is going to go up and over the three major branches of the aorta, namely the brachiocephalic artery, the left common carotid, and the left subclavian. Then this guy's going to begin to skirt its way across the right of the midline, and where they come together is going to be SVC, superior vena cava. That will remain until it transitions into right atrium. So this is a kind of a transition you want to keep in mind as we look at the venous side. Questions on that? We'll look at actual images here in a moment. I'm going on this side over here and show you the arterial side. It's a little bit different. And again, we'll map this out for you. What you're going to have, and I'm going to focus on the right one to start off with, is that you're going to have the right common carotid artery that's going to come down, and it's going to come all the way down toward the right of the midline like this, and coming from the periphery of the patient, smaller in diameter, is going to be the subclavian artery. The subclavian artery, you're going to find is going to be posterior to the subclavian vein. That's one characteristic to look for. The other is the vein, because it has less blood pressure to it, is larger in diameter. So it's going to be larger than what you see in terms of arteries. In general, that's pretty much a rule you can use. If you have a complement of two vessels, for example, the SMA, superior mesenteric artery, and superior mesenteric vein, when they're seen in the patient's body, different modalities, the vein typically will be larger than the artery because you have less pressure driving it through the tissues, so therefore it's greater in terms of its diameter. In this case, what happens is this. You're going on the right of the patient's midline, and what happens at this point is they come together, and where they come together is going to form the first branch of the aorta, which is going to be brachiocephalic artery. That's one of the first branches of the aorta. So as the aorta comes up, it's going to come up this way, it's going to arch over. The first branch is brachiocephalic artery. The left is not going to have to go through this transition forming this brachiocephalic artery. Rather, what you're going to have is it coming directly down the neck and becoming one of the major branches of the aorta. So this is the left common carotid artery. And from a learning perspective, we call it the second branch. We go from patient right to patient left. Then, as the arch begins to its downward turn, you get a smaller one here, which is going to be the left subclavian artery. Left subclavian artery. So the three branches we're going to find of the aorta will include the brachiocephalic artery that will eventually bifurcate to form subclavian artery on the right side, as well as right common carotid, left common carotid, and then you'll get into left subclavian artery. So when we look for these, as you're slicing down, you start to see these appear until you get down to the aorta. So the aorta is going to come up this way, arch over, and then go down just to the left of the midline. The aorta is going to have three components to it. It's going to be the part that leaves the left ventricle in the form of the ascending aorta. The arch itself, and then the descending aorta. So you'll get these three portions of the aorta seen at different points. So when we're looking at a sectional image, if I look at the arteries themselves, we'll show you some actual examples of it here in a moment. But what happens is, when you look for the three branches, you're going to see in part the arch coming up, and then you'll see the first branch is the brachiocephalic artery, the second branch as the left common carotid, and finally the third branch, which is the left subclavian artery. So it's going to kind of arch over like this and come down. So you'll be scanning through those. On the aorta, and we'll better show you than try to attempt to draw it, you're going to find the ascending aorta and the descending aorta are pretty consistent where to find them. The ascending is going to be located more anterior than the descending. So you can kind of pick up its location and what you're picking up. Questions on my artwork? Are you impressed?
Very.
I want you to know I practiced, okay? Because I suck at artwork, so I'm really happy with that. All right, with that said, let me show you how it appears from an imaging standpoint. Every time I put this on mute, I'm always worried it's not going to work. Okay, here we go. I'll lower the lights here in a moment. And we'll cover this in earnest on Thursday of next week. I'm going to show you what we're dealing with. So from a landmark standpoint, what happens is that you're getting a lot of beam hardening artifact right through this area, right through here. So a lot of it's going to be kind of modeled from that perspective. Here's where we left off at the neck in terms of C7 to T1. We have the classic trachea, we have esophagus, both lobes enhanced with contrast medium of the thyroid gland. On this side, I'm going to focus mostly on the right. Here is the sweeping, we'll look at it better here in a moment, the sweeping of the internal jugular vein as it goes from somewhat of a midline position to meet up with the subclavian vein. Here and here are the two carotid arteries. So right now we don't see much of in terms of the subclavian vein, but as we work our way down, what you see is a combination of structures. Ignore the ribs right over here. The patient was injected on the left side, so it looks very bright. And of course, this is an older scan, so you get a lot of spray from the contrast media. But here's what you have. You have the right common carotid. You have the right internal jugular vein. You have the right subclavian vein. And then finally, you have the right subclavian artery. Typically, the vein will be larger in diameter as compared to the artery, and then we're looking at the interplay between these two until they form brachiocephalic. Here, the contrast medium, because of beam hardening, is going to show the axillary portion going into subclavian right below the clavicle, and where it forms here, it's already forming the left brachiocephalic vein.
John,
Go,
really quick.
yes, ma'am.
I don't think this PowerPoint's online.
Is that online?
No.
Oops. Oops. You're right.
None of the week of October 4th stuff is.
It is. I'll get it fixed now. Best laid plans, I'm going to tell you. All right, we go up this way. And while I'm doing brain fast, so we'll keep that a surprise. All right, if you refresh, will it pop up now? Okay, this is the one I'm working off right here, contiguous slices.
Thank you.
Yes, ma'am, I should have thought of that before. All right, we're gonna cover this again anyway. All right, so here are these vessels kind of all laid out here. Because of beam hardening, it's kind of hard to pick up. If we continue down here, you have this transition over here. This is where you have that bulbous appearance. This is where you're gonna have the internal jugular vein meet up with the subclavian, and this is gonna form the right brachiocephalic vein. The left one's already there. Again, it's where we injected on the side of the patient. So it's pretty much gonna be here from that perspective. Here's the right common carotid artery, and we can't quite pick it up, but we will here in a moment. What's meandering over posterior to the subclavian vein is gonna be subclavian artery. Trachea, esophagus, you can tell we're still in the region of the upper chest area. Here, a gradual transition is that we have the following. We have subclavian vein, we have the birth of the right brachiocephalic vein. Here and here, this is that subclavian artery, smaller in diameter and posterior to the vein. It's kind of sweeping in this way. And we're getting it at two different partial voluming areas. This is the right common carotid, this is the right subclavian artery as it stands right now. Left common carotid and left subclavian artery. Here, because the contrast appears wider, is the right brachiocephalic vein. So we'll be looking at the interplay between these two. Trachea is still in place, working our way down.
John,
Yes.
wouldn't that be the left side?
Oh, left, I'm sorry, you're right. So here's the left, yeah, left common carotid, left subclavian, left brachiocephalic, thank you. Here, we have right brachiocephalic vein, left, arching over the anterior portion of the mediastinum. So you have left brachiocephalic vein, and here's a transition point. What you're picking up is the last glimpse of right common carotid, and below it is the last look at right subclavian artery. Left common carotid, left subclavian. Okay? So as you continue down, you get not only the left brachiocephalic vein coming up and over this area called the anterior mediastinum, and the right brachiocephalic vein, but you get the three branches, three stooges, old term we used to use for this area, is that you see the three branches of the aorta. So you went through a point above it where you had a lot of transition of those vessels to a point where all three of them are showing up. So going from patient right to patient left, brachiocephalic artery, second branch is left common carotid, third branch is left subclavian artery. Left subclavian vein is coming up and over, and again we'll look for the transition of those two vessels coming together to form the superior vena cava. These guys are transitioning out, you can tell right over here, and again with this little wedge is right up here. It's called mediastinal fat in the adult. In the child, it's the residual, well actually it's called the thymus gland in the child. This is the residual aspect of the thymus gland. It no longer is functioning for most adults. So oftentimes textbooks will refer to it as mediastinal fat. Kind of a conical pyramid-shaped structure over here. These three are transitioning out. These two, the left brachiocephalic vein, the right brachiocephalic vein, are coming closer together. Working our way down, pretty much gone in terms of the three branches. What's going to be seen below it is going to be the aortic arch. The left here is going into the right. So we've almost completed that transition. As we work our way down, now at this point, this would be SVC. We're right around the area of T4 and aortic arch. It has that oblique diagonal shape to it, and it's going to be found inferior to the three branches. So again, just some landmarks. Here's trachea, here's esophagus, SVC, aortic arch, and what we call mediastinal fat. Going down, transition again, we're getting below the arch. And these are starting to pick up a somewhat of a circular appearance about them. One here, these are transitional, and then one down here, and once again to patient right is going to be SVC. Going down, you get distinctive ascending aorta and descending aorta. SVC, trachea still is classic, but you produce this little space here, which we're going to talk about next week. It's rich in lymph nodes, and it's a common site for chest metastases and even primary tumors because of the amount of lymph nodes in it. So for those that are doing chest CT, oftentimes they'll have you do finer slices if the patient has a history of ovarian cancer, lung cancer, of course. Another one that slipped my mind, right? Maybe it's liver. But this area oftentimes will show signs of enlarged lymph nodes. So in imaging, we call it the aortopulmonary window, aortopulmonary window, which we'll talk more about next week. So this area is kind of significant from a clinical perspective. SVC, ascending aorta, descending aorta. This little guy over here is called the ascus vein, which we'll talk about next week. And then I'm kind of getting into some new areas over here. The pulmonary artery is going to be coming in this area right through here, between the ascending, descending aorta, SVC, and we'll get into pulmonary artery later on. We call this the inverted Y sign over here. So what we have is the trunk of the pulmonary artery. We'll talk more about it. Going into right pulmonary artery and left pulmonary artery. So that inverted Y is really making up the characteristics of the pulmonary artery. What makes the pulmonary artery unique?
It's an artery that doesn't have oxygenated blood.
It's a venous structure in essence. How about the pulmonary veins, which are farther down?
The only vein with oxygen.
Yeah, so you have veins, you have 4 of those. Okay. So when we get down to this level, we'll get in more detail in terms of pulmonary artery. We'll get into the major chambers of the heart and then pulmonary veins. Okay. So again, we're going to focus on mediastinal windows, on these that focus on the vessels in the heart, and some soft tissues. We'll get into a few muscles, which will further expand when we get into that area of extremities, and we'll give you more detail what these involve. Okay, but the big deal is this transition up here, if I can shoot back up, is the one that kind of is a bit mind-blowing because you have so much going on here. And you're going to have to kind of memorize which of these you're looking at. Right common carotid, right internal jugular, right subclavian, and right subclavian vein, and then right subclavian artery. Okay, this is kind of just an introduction to it, and we'll get in greater detail as we get into the chest next week. Questions? You guys ready for a little brain review? Brain strain. All right, pull this up. As we go through the brain, one more time, I'm going to be asking you some questions, okay? Just quick reads, all right? For example, what is this white thing over here? We already know from Freddie's presentation on the CT. What is this white thing in general called?
Corpus callosum.
The corpus callosum. What is this? What is its function? To provide communication between
The left and right hemisphere.
left and right hemisphere. So that's kind of the key function. So that's a very specialized white matter tract. When we look at it, we break it down to components. We have the rostrum, genu, body, and splenium. Here we have, seen in part, the lateral ventricle. Here, this great matter structure right over here is the thalamus, which is going to be paired structures we'll see on the transverse images, which will help form the lateral walls of the third ventricle. Please remember the 3 components that make up the brainstem, namely midbrain, pons, medulla back over here. This linear line running oblique is the communication between the third and fourth ventricle, known as what?
Cerebral aqueduct.
Well done, cerebral aqueduct. And then this little tissue back over here that doesn't look like it's connected on the transverse is what? Tectum. Contains these little bumps. What are those little bumps called? Help us in terms of auditory movement of the eyes. Colleculi, superior and inferior colleculi. Not that you can see them This diamond-shaped structure here is
Fourth ventricle.
fourth ventricle, very good. The upper portion of the cerebellum, that is another connector, is called what? Vermis. So you have the vermis right over here. Clivus over here, which is a bony structure that's going to eventually form the anterior portion of the foramen magnum. And what you see basically is a linear line going up this way, which would be basilar artery. Make sure that we look at our cisterns. Here's the prepontine, the pontine cistern over here, and the one located between the sella turcica and the midbrain right through here is referred to as the suprasellar cistern. So it's right above the sella turcica pituitary gland. What's these little dots right here?
Medullary bodies.
Medullary bodies is part of the limbic system. What other structures make up limbic? Remember? Maybe two others you could think of. What's the one that helps us convert short-term to long-term memory? It was a riveting lecture, I can tell. It was hippocampus, okay? This one's going to also help these medullary bodies. There's another, the one that connects between the hypothalamus and the pituitary gland called the infundibulum, which we'll see later on. The questions on this level. A little bit different in terms of sequence. Over here you get a little bit more cerebellum. Right over here we get a density, which is another dural covering known as tentorium cerebelli. And then there's a flovoid artifact right through here that's draining venous blood along a venous sinus called straight sinus. How many lobes, by the way, are there for the cerebrum? Five, good. Okay. Not the best image right over here, but if I told you this was the second cranial nerve, which one would that be? Optic nerve. Good. Landmarks that you're going to pick up on the upper cerebrum are very few. Once again, fielder's choice, longitudinal fissure or falx cerebri, or if it's a full artifact, it would be superior sagittal sinus. Upfolds are called gyri, and then valleys are called sulci. Going down one more. Here we have once again the hemispheres of the cerebrum, falx cerebri, longitudinal fissure, or to a certain degree superior sagittal sinus. This burst of white matter tracts is really important. Perhaps one of the key landmarks of the upper cerebrum, which would be centrum semiovale, right through here and here. It's a paired structure. Going down, we get into the first glimpse of the ventricles. Here it's kind of fuzzy, so we're probably getting a little transition of the body of the corpus callosum. Here we see the genu of the corpus callosum, splenium posterior, maybe early signs of septum pellucidum. Of course, both lateral ventricles. The first of the basal ganglia right through here and here, which is caudate nucleus with its three components: head, body, and tail. Again, that triangular shape either could be a flovoid artifact. Different pulse sequence shows it up somewhat of a bright signal. That's going to represent right on the midline the superior sagittal sinus. Continuing down, we have a clean image of septum pellucidum. Once again, genu, splenium. The little spaghetti in here is choroid plexus, which helps us with the formation of CSF. Once again, the three components of the caudate nucleus pretty much seen. Again, anterior head, body, tail, superior sagittal sinus. Going down, transition, the upper part over here is going to be septum pellucidum, and we'll see almost a diamond shape, not quite there yet, which is another portion of the limbic system called the fornix, which is going to be right over here. Here, early signs of the thalamic bodies, or thalamus over here, and what will transition between them is going to be the third ventricle. Taking around the horn, we have anterior horns, posterior horns of lateral ventricles. Once again, genu, splenium right over here. We mentioned choroid plexus, and we're starting to pick up early signs of the second group of lentiform nucleus, or of basal ganglia called the lentiform nucleus, which we see a little bit better over here. Head of the caudate nucleus is going to pretty much remain adjacent to the lateral ventricles. Genu, we have a band of white that comes over here between the two basal ganglia. That band of white are referred to as capsules. This is the internal capsule here. Outside of the lentiform nucleus is going to be the external capsule. Keep in mind the lentiform nucleus has two components. Do you recall what those are? Lobus pallidus and then putamen. Putamen. Which of the two is lateral? Putamen. Okay? Here's the third ventricle on the midline. Here's my thalamic bodies right over here. Once again, the superior sagittal sinus. On this coronal, we pick up part of the corpus callosum. We're not sure what we're seeing. This one kind of shows us a little bit different perspective. B would represent head of the caudate nucleus. The forked appearance right over here on a coronal actually represents the fornix. Right through here. We have head of the caudate, as I mentioned before, coming between them and lentiform nucleus is going to be internal capsule right over here. Outside of it is going to be external capsule, early transition into third ventricle. What's this guy over here? Oh, that's good. Continuing down, head of the caudate nucleus over here, lentiform nucleus, internal capsule, third ventricle, posterior horns, superior sagittal sinus right through here. That teardrop shape, it looked forked on the coronal, which actually is the fornix.
John,
Yes, ma'am.
on that coronal, if you're pointing at the head of the caudate nucleus,
Go back.
couldn't that be the genu if you're pointing at the head of the caudate nucleus? Couldn't A be
Oh, right
the
over
genu?
here? I mean, this is Genu through here?
Yeah.
Yeah, it could be. Yeah, that's a good point. It could be Genu. Since I'm looking at this guy back here, the reason why I was kind of vague is that the fornix is going to show up a little bit more midline, so I really couldn't swear, but it could be Genu.
Okay.
You're right. Good point. If I look over here, guys, we have the lateral fissures. What do we find out here in that gray matter structure? Insula, which is the fifth lobe of the cerebrum. Coming back. Once again, we're seeing over here, third ventricle, right down the midline. We're picking up thalamic bodies, that forked appearance, part of the fornix. These guys are soon transitioning out in terms of caudate nucleus and lentiform. You're having possibly early signs of straight sinus. We're not quite there yet. And if we look at this area right through here, look at lower down. You get that thing right here. What's that over here? Pineal gland, which is producing melatonin. So here's my third ventricle. Here's my posterior horns. Possibly now transitioning into straight sinus. Because the next level down, we'll get into midbrain. And that's where we expect to see both straight sinus and the tentorium. Going over here, I'm going to go down one. Well, here we go. Okay. Here, we're getting into midbrain level. We'll get better detail here in a moment. Here is vermis popping up, and that wishbone-shaped structure is going to represent tentorium cerebelli. And we're early getting signs of straight sinus back here. And you can see that there's some irregularity in the appearance of the superior sagittal sinus going into the confluence. You guys know your components of the 5 parts?
Well, not
Okay,
yet.
I would study those. Internal carotid, anterior cerebral, bilateral, the singular, anterior communicating, going from the internal carotids back this way, our posterior communicating arteries, coming up this way, basal artery, and it forms the last portion of the circle of Will, or arterial circle called the posterior cerebral arteries. Kind of keep that one in mind, if you would. Midbrain, you have the first set of peduncles. Keep in mind the cerebral peduncles are going to connect the cerebrum or cerebral cortex to other portions of the brain, specifically midbrain, which is right over here. The little mouth of Mickey is the passageway between the third and fourth, which is cerebral aqueduct over here, those little bumps right over here, part of the tectum. Good. Once again, you have tentorium cerebelli, vermis here, and this irregularity is beginning to transition into straight sinus, and you're getting a little deformity. We'll talk about here in a moment. Cisterns are important at this level, so remember these. Suprasellar cistern here, interpeduncular cistern between the ears, between on both sides of the midbrain, ambient cistern, and the one located between the vermis and the tectum, at least on this perspective, is called superior cistern. So these are kind of important. Little mammillary bodies over here, see those little rascals? Part of the limbic system. From different perspectives, this one I really like, okay? I see the cell turcica, but over here, on this coronal slice, it gives us a couple of key structures. You have the optic nerves or optic tracts over here, running horizontal. The infundibulum right through here, that's gonna link the hypothalamus with the posterior portion of the cell turcica right through here. And here's a little bit different perspective of the suprasellar cistern right over here, okay? Optic tracts or optic nerves, infundibulum, and this part of the pituitary gland right there. Transition down, the only thing really new on this one, a little bit more generous view of tentorium cerebelli, a little bit more detail of the straight sinus. Here, we're getting a little hint of the carotid arteries, internal carotids, and the singular one located within, near the pons would be what? Basilar artery. Basilar artery. Continuing down, pons level, going anterior to posterior, clivus, basilar artery. I have the pontine cistern right through here. Because we have the trigeminal nerve going through this area, it's called the cerebellopontine angle, or CPA, on either side. Here, of course, is pons. Wrapping around it is the second set of peduncles called the superior cerebellar peduncles, right, coming off in this direction. And they're wrapping around the fourth ventricle. Vermis is a little bit more generous back over here. And here, at this point, you have a union between straight sinus and the superior sagittal sinus, which we call confluence of sinuses, and it begins to form these little branches out here, which are the transverse sinuses. Going down, jumping all the way down the medulla. Here we have the medulla. We have the anterior portion of cella turcica, and right between medulla and the foramen magnum is basilar artery. Here is the final set. We can't see the middles very well, but this is the final set of peduncles, which are the inferior cerebellar peduncles. It links the pons to the cerebellum. What's left of vermis over here. Here is my cerebellar hemispheres over here, and here, transverse venous sinuses. One more level down. We're in medulla, okay? These are called what?
The tonsils.
The cerebellar tonsils. And what condition oftentimes is it where they herniate through the foramen magnum? What do we call that? Remember? Arnold-Chiari. Arnold-Chiari. So over here is the medulla, and you see like these two little specks over here, anterior, representing what? Pyramids. And pyramids do what? They're responsible for decussation, where the nerves of the body are going to switch over. So that's a little area here, the pyramids on both sides. You have the cerebello-medullary cistern back here, and this S-turn right through here and here is the final portion of the venous sinus in the form of the sigmoid sinuses. So how was that?
Better than last
Better than last week? Okay, what are these guys on both sides over here? Just for grins.
Vertebral arteries.
Before they form the singular basilar. Let me jump down one more. Know your branches. Venous sinuses, we'll go down one more, okay? On this oblique, you have superior sagittal sinus coming down from midline, back posterior, you have straight sinus. This region over here is gonna represent confluence of sinuses. Better seen on this side over here, transverse sinus, making the S turn, going into the sigmoid sinus before you go into the creation of the internal jugular veins. Okay? So how was that? You guys feel like you're ready?